In the last session, we discussed definition of infertility and reasons for infertility, whether it is in the males or females, we discussed it clearly. In this session, if the person having infertility, how we are going to be treating that infertility problems, we will discuss now clearly. First of all, we can take over here, that is the treatment. Okay, some special healthcare units, some special healthcare units like infertility clinics can help in diagnosis. It means some of the infertility clinics are available in our country. Those are help to diagnose the problem. Diagnose means detect the problem, which is with the problem whether it is there in the male or female, detecting and what kind of problem is there, how we are going to be treating those problems. We'll get a clear idea when we are going into the clinic, infertility clinic, and we are testing over the problems. Clear, right? And treatment of some disorders and enable the couple to have a child. Here these infertility child health care centers are useful for the treating of some disorders, not all. Some disorders we may treat. 80% of the infertility problems are having a medicines or having the treatments. Now we can see treatment of some disorders and enable the couples. Enable the couples means couples are getting ability to produce a child or to have a child. Okay, such conditions or such treatment is provided by infertility clinics. But in all over the area in the small villages or in the small towns, we are not getting infertility clinics. They are in the only in few areas of our country. Right. Now we can see here, however, when corrections treatments are not possible, certain special techniques known as assisted reproductive technologies or arts can be used. It means whenever if you go to the infertility clinics, sometimes for some disorders you may get the treatment, but in case infertility clinics, if you are not getting the medication, if you are not getting treatment properly, at that condition we'll move to the another assisted reproductive technologies. By using these technologies, the infertility couples may have the child. Clear? These techniques are helpful to produce the child for the infertility couples. The corrections are not possible, treatment is not possible. In that conditions only we will move to the assisted reproductive technologies. Clear? Right? Now, the main ART techniques includes, what are the ART techniques or how many types of ART techniques are available in our country, we'll discuss now. See here, the first one is IVF ET. What is the meaning of this one? It is a very important question for the 3 marks, or sometimes they may ask you abbreviations, that is for 1 mark. Clear? Right? Now we can see IVF ET means in vitro fertilization and embryo transfer, followed by embryo transfer. Okay, now we can see here in vitro fertilization, embryo transfer. What is the meaning of in vitro, in vivo? In vitro means the development of the baby or development of the embryo outside of the female body, nothing but in the laboratory. We can consider it as a in vitro. In vitro. Vitro means outside or external. In means, in vitro means not inside the body, outside the body of female. Growing up the embryo or developing of embryo takes place. Such condition we are called it as a in vitro. If in case of in vivo, inside the body normally developing of embryo takes place. Such condition we are considered as a in vivo. In vivo means inside, in vitro means outside the female body. Clear? Now, here we can see when we are following actually this IVF technique, means it may be the problems are, we are noticing here test tube baby growth, it may be the problems are there in the fallopian tube region of the mother, or maybe sometimes what happens is here sperm production is less. Okay, sometimes maybe problems may arise in the egg production. Okay, sometimes problems may there in the fertilization. Sometimes problems may there in the fallopian tube. Sometimes problems may there in the uterus. Now we can see in so many areas we are noticing the different kinds of the problems. Now in this technique, what how they are developing the embryo, we'll see here. In this technique, what they will do is here, it is popularly known as a test tube baby. It is popularly known as a test tube baby program. In this case, what happens is, they will collect the, doctor will collect the sperms from a healthy donor or from the husband, eggs collected from the healthy female or a healthy female donor. Now these two they will place in a test tube. They will place in a test tube. Now we can see here sperms as well as eggs. They will place in a test tube. These test tube, in this test tube they will maintain the simulated conditions to the female reproductive system. Simulated means nothing but same conditions of female reproductive system, they will maintain it. After that, few days, what happens is here, or few hours or few days, what happens is, in this test tube, zygote will form. Zygote will form. This is the zygote. Zygote. Here we can see, first they will collect the sperm cells from the male donor. Next they will collect the egg cells from the female donor. Both they can mix in a test tube. The test tube, they will maintain the same conditions of female reproductive system in the test tube, and after that what happens is here it will undergo fertilization. After the fertilization, these will form a zygote. After that, the zygote they will place in a another fresh medium containing test tube. In this case what happens, the zygote is undergoing cleavages. It forms a blastomers, blastomer cells that we can say it as a cleavage. Undergo cleavages. After the cleavages, the zygote forms 8-celled stage early embryo, or else more than 8-celled stage. You can see here, first of all, I will repeat it one more time. First we will collect the sperm cells from the male donor, egg cells from the female donor. will mix in a test tube, undergo the fertilization, and it forms a zygote. After this, the zygote placing in the new test tube containing fresh medium, it undergoes the cleavages. During cleavages time, we will get the early embryo in 8-celled stage or else more than 8-celled stage. If the embryo up to 8-celled stage, we can transfer into the fallopian tube region. That condition we are called it as a gypped method. You can observe it clearly. Up to 8-celled stage early embryo, we can transfer into a fallopian tube region of the female at the ampulla isthmus junction. Clear? Now we can see that at that condition we can consider it as that method we can consider it as a gypped method. Gypped means zygote intra-fallopian transfer. Here we are transferring zygote into a fallopian tube region. That's what this method we are calling it as a gypped method or zygote intra-fallopian transfer. Clear? Now, if in case the embryo or the zygote undergoes cleavages and forms more than 8-celled stage, it means 16-cell stage or 32-cell stage. In this condition, we will transfer this early embryo by using micropipette into the uterus. That method we can consider it as a, or we can say it as a IUT. IUT means intrauterine transfer. Till now, whatever the methods we discussed now, these all methods are belonging to the category of in vitro methods. These are in vitro methods. If you see the first one, growing of embryo in a laboratory, it means outside the female body, and after that the embryo developing at 8-celled up to 8-celled stage, we can transferring into the fallopian tube region. The method we can call it as a gypped method. If it is more than 8-celled stage, we can transfer directly into the uterus. That method we can call it as a IUT method. Clear? We're getting clarity about these techniques, right? Now we can move to the next technique, that is the gypped method. Here you can see that gamete intra-fallopian transfer. It means sometimes female is unable to produce the eggs. Already you noticed that physical problem in the females, that is the polycystic ovarian syndrome. At that condition, female not able to produce the eggs. That condition time, will collect the eggs from donor and will place the eggs in a fallopian tube region of the female. In this condition, the problem only in the ovaries, not in the fallopian tube region, not in the uterus region. That's what, just will collect the eggs from another female and place in the fallopian tube region of this infertile patient. Okay, that condition that method we can say it as a gift method. Here another female is giving gift to this infertile patient. That's what we can say it as a gift method. It means nothing but gamete intra-fallopian transfer. The meaning of this one is gamete intra-fallopian tube transfer. Here the gametes we are collecting from donor. Because this female is unable to produce the egg cells. Okay, clear? Now, next one, if you see here, ICSI. ICSI meaning is intracytoplasmic sperm injection. If you see here, fifth one, ICSI, intracytoplasmic sperm injection. What we are going to be doing is here this is, if you take it as egg cell, Now, if you see here, this is the pipette. In this pipette, we are taking immobilized sperm cells. Sperm cells will collect into the pipette and directly will introducing into the, this is, we can consider it as a cytoplasm. This is the cytoplasm of the egg cell. Now this is the egg. If you see, this is the egg cytoplasm. We are introducing immobilized sperms into a cytoplasm of the egg cell. This technique we are called it as a ICSI. I means intra, C means cytoplasmic, S means sperm injection. By using micropipette, we are injecting or introducing the sperm cells into the egg of the female cytoplasm. This technique we are called it as a ICSI. Clear? Now the next one, last technique. This is also in vitro fertilization. It is also in vitro fertilization. You can see here we are introducing these sperms into the egg. We are developing embryo outside the female body. That's what we are saying it as a in vitro technique. Now lastly we will discuss about the AI. AI means artificial insemination. Artificially we are introducing the sperms into the female reproductive tract. Actually, naturally, the sperms are entering into female reproductive tract while participating in sexual contact. But in this case, the problems may present in the male reproductive system. That is the physical problems we are noticing. Small sized penis or erection dysfunctions we are noticing in the males. At that time, what we are going to be doing is here, we will collect these sperm cells from the male. We are introducing these sperm cells. First we will collect the sperm cells. These sperm cells are introduced into two ways, means two areas. One, the introducing into vagina or cervix in one case. In one more case, we are introducing these sperms into uterus. Okay, this one we can call it as a, this technique we are call it as a IUI, intrauterine transfer. IUI, intrauterine insemination. You can see here, artificial insemination means we will collect these sperms and introducing into the vagina of the female or cervix of the female, or sometimes we will introduce these sperms into the uterus. This condition we are call it as, this technique we are call it as a IUI. IUI means intrauterine insemination. Here the difference we are noticing between these two is, in this case we are introducing the sperm cells into the uterine region. Here we are introducing sperm cells into the cervix and vagina region. Okay, these both are belonging to the artificial insemination. Clear? Are you getting clarity about these all techniques? Clear? Now we'll see that one more time. I will revise these things clearly. We'll see here. First of all, we'll go to the treatment. The treatment is available in a infertility clinics. If the corrections and treatment is not possible, the infertility couples are going into the specialized techniques, are taking the specialized techniques. Those are assisted reproductive technologies or ARTs. Here the main assisted reproductive technologies list we are given. That is 1. IVF ET, in vitro fertilization followed by embryo transfer. Second one, GIFT method, zygote intrafallopian transfer. Third one, IUT, intrauterine transfer. Fourth one, GIFT method, Gamete intrafallopian transfer. Fifth one, ICSI, intracytoplasmic sperm injection. Sixth one, AI, artificial insemination. I told you already. Here you can see that in vitro fertilization time we are developing embryo outside the female body. That's what we are considering. This technique is in vitro fertilization technique, IVF, in vitro fertilization technique. Under this category we are discussing three things. That is, one is GIFT method, IUT method and ET method. GIFT method means what we have done here. Here we are taking the early embryo at the stage of 8-celled stage. We are transferring directly this embryo into the fallopian tube region. That's what this technique name is called as a GIFT, zygote intrafallopian transfer. Zygote intrafallopian transfer. Now the next technique time what we did is intrauterine transfer. Here more than 8-celled stage early embryo or zygote will transfer directly into the uterus. That condition the technique we are calling it as a IUT technique. When we are following this technique is, if in case the problems are there in the fallopian tube region, directly will enter into the uterus. Right. That is intrauterine transfer. Now third one, embryo transfer. Embryo transfer in the sense, if you see here, the problems may there in the female, that is they are unable to produce the egg cells. At that time directly will develop the embryo outside of the body of female and directly we introduce that embryo into the uterus for the implantation. That method we can consider it as a embryo transfer. Here this embryo sometimes will transfer into the surrogate mothers. Here you can see that. Surrogacy means nothing but here a woman, surrogate mother, a woman bears a child for couple unable to produce a child. It means another female developing baby who are not having an ability to produce the baby. Here you can see surrogacy means here a woman or surrogate mother bears or contains or developing child for couple unable to produce a child. Who are unable to produce a child, no? For them, these surrogate mothers are helping to produce the baby. They will develop the baby in their body and giving it to the infertile couples. Such condition we are calling it as a surrogacy. In case of ET, we are taking help from the surrogacy. Sometimes the problems may there in the uterus, sometimes problems there in the fallopian tube region. At that time, directly the embryo will develop into the in vitro technique by using in vitro technique and transferring into the surrogacy or surrogate mother. And in the surrogate mother, the embryo is getting into fetus. After that delivery, the baby will give to the infertile couples. Right. Now, next one we'll see here, sperm banks. Sperm banks mean storage of sperms with the help of the cryopreservation. Here you can see that we are collecting the sperm cells from the male donors. If the sperm cells are, in case of the developing hybrids or in case of developing the healthy breeds, at that time sometimes what happens, we'll collect the more sperm cells from the male donor. Some we are using for this technique and some we are preserving in the laboratory with the help of a cryopreservation technique. Right? Now we can see. Now fifth one, that is ICSI. In this case what we did is, in this case ICSI, in vitro intracytoplasmic sperm injection. In this technique what we did is, we will collect the immobilized sperms are not having mobility. At that time we will collect those sperm cells we are directly introducing into the egg cells of the female. That condition we are considered as a ICSI. And sixth one is AI, artificial insemination technique. Here what we did is, artificial insemination means sperm cells were introducing into the female reproductive system. That in two ways. One is we are introducing in the region of vagina or cervix, or one more time we will introduce directly the sperm cells into the uterus. This technique we are call it as a IUI, intrauterine insemination. It is very important for the entrance exams time they are asking this meaning. Clear? Now lastly, this we forgot it, we will discuss one more time. Gift method. Gift means gamete intra-fallopian transfer. Here what we are doing is, we will collect the gametes from the donor, we will introduce those gametes into the fallopian tube region of the female. This condition we are call it as, this technique we are considered as a gift method. Clear? Right. Thank you. Up to this we discussed clearly the concept of reproductive health. I will provide you PDF notes in WhatsApp group, and stay home, stay safe.